Hey everyone, my name is Haney Mallemat from the University of Maryland, and today I'm so excited to tell you about the Critical Care Bootcamp happening on March 12th. Myself and Mike Winters are co-directors, and along with Evie Marcolini and Peter W., we are going to go over tons of great critical care. Now, do you take care of really sick patients in your emergency department? Do you have to hang on to those people because there are not enough beds in the hospital, or have to transfer those patients out? Or maybe you feel like you want to take better care of those patients in the first couple minutes. Well then, this boot camp is for you. The things we're going to be talking about are covering a lot of ground in critical care. We're going to talk about the approach to the patient with undifferentiated shock. You ever get that really sick person and you don't know exactly what's going on for them? This lecture is going to help you out. How about the asthmatic patient? Not the person that needs a neb or two, the person who is an extremist. How do you take care of those people and make sure they have good outcomes? We're going to talk about the patient who's mechanically ventilated and starts to crash on you. We're going to do some post-arrest care, some things that you can do post-cardiac arrest that will make a difference in the outcomes of your patients. We're going to talk about vasopressors. Which ones should you give, how often to give them, what doses to give. We're going to talk about hypertensive emergencies, intracerebral hemorrhage. How about the patient who has tamponade, who's stable-ish, but is slowly starting to crash on you? What interventions can you do? What are the things you need to know so that patient has a good outcome? How about a patient in sepsis? Do you ever see a patient in sepsis? Yeah, we all see patients in sepsis. We're going to give you some tips and tricks on how to take care of the really sick septic patient. Patients with traumatic brain injury. What are the things you need to do and the things you need to avoid to take better care of that patient? And then interspersed throughout this whole day is going to be a bunch of cases that we're going to go over as a panel and individually. Now, this differs from the main conference. The main conference is going to be fantastic. It's going to be huge. But the boot camp is different in the sense that we're going to be a smaller crowd, more intimate. We're going to be able to discuss things. You're going to be able to stop in the middle of the lecture, ask us questions, and then interact with us during the break session. So boot camps are a great way to go if you want to have a more intimate session and a more personalized educational experience. So I really hope to see you on March 12th at the Critical Care Bootcamp. Again, it's going to be me and Mike Winters, who are the co-directors, along with Evie Marcolini and Peter W. This is going to be a fantastic day of education, and I hope to see you there. See you soon.